Hi, I'm Shail Gupta, and this is my presentation on cervical cancer. The reason I chose this topic is because I wanted to learn about something new. As you will see on future slides, the rate of cervical cancer in the US has decreased significantly. However, around the world, case numbers are starting to soar. Cancer is a disease where body cells have an uncontrollable growth, spreading and destroying healthy body tissue. Cervical cancer can hence be described as a malignant tumor where cells in the lower part of the uterus are affected. Cervical cancer is among the 5 main types of gynecological cancers that affect women's reproductive organs. These are cervical, ovarian, uterine, vaginal, and vulvar cancer. This type of cancer only affects women primarily because they have a cervix. It mostly affects women between the ages of 33 and 44, and according to the American Cancer Society, the average age of diagnosis is 50 years old. The national annual rate of new cases of cervical cancer in 1999 was 9.7 per 100,000, and the number of cases that were reported were 13,914. This rate slightly decreased to 8.1 in 2009, and the cases diagnosed were 12,915. The 2019 data shows that the rate stands at 7.5 per 100,000, and the total number of cases was 12,795. Things are getting slightly better. For instance, California and Nevada, which had rates of 10.4 and 9.8 per 100,000 in 1999, now have 7.1 per 100,000, and Nevada had less than 16 cases in 2019. The map above and the one on the next slide show cases of cancer within all ages, race, and ethnicities in the U.S. American Cancer Society estimates that in 2022, there will be around 14,100 new cases of cervical cancer. Nearly all cervical cancers are caused by certain strains of HPV. In the early stages, this disease does not produce any sign or symptom. However, once you begin to get to an advanced stage of the cancer, the symptoms start to become very prevalent. Factors that may increase the chance of getting this disease are HPV infections, weak immune systems, or even family history of having cervical cancer. To diagnose this, a Pap test is one of the most common, where cells from the cervix are examined. Like most cancers, treatment depends on the stage of the cancer. Options are radiation to kill the cancer cells or chemotherapy. Treatment of any cancer is an intensive and emotionally draining process. As a result, prevention is considered the best approach. According to the American Cancer Society, women aged between 25 to 65 years old are highly recommended to undertake an HPV test every 5 years and a Pap test every 3 years. Educational campaigns are vital as it helps people understand the importance of limiting their exposure to HPV as a whole. These are my references. Thank you for listening.